Shereen in Delhi for a special interview. Shereen, over to you.
Well, thanks very much. There have been recent reports of the CoWIN portal, which is being used to register for vaccinations, being hacked and the data of millions being leaked. This has been refuted by the government. Beyond the concerns raised around data security, there have been concerns raised by the Supreme Court on the digital divide and what that could mean for the universalisation of a vaccination. Well, to talk to us about all of this, joining us now is the CEO of the National Health Authority, Mr. R.S. Sharma. Mr. Sharma, appreciate you joining us here on CNBC-TV18. Let me start by asking you about this so-called hack, because the government and you in your statement have come out and said that prima facie it seems like these reports of hacking are baseless, but this is something that the CERT is looking into. Can you clarify for us what is the basis on which the government believes that this is not a hack?
Well, thank you very much, Shereen, for having me on your channel. And I think it's a very relevant question which you asked, the first question, which is the data hack. So, you know, then when the report came, obviously, we also got concerned and we said, let's find it out. So we put in our agencies on work to figure it out. And immediately we got the report that this is apparently prima facie not correct, because that particular site which offered these facility of taking the data of selling the data of 150 million Indians on the CoWIN platform. That site was down since last 5-6 hours, from 4 p.m. to 9 p.m. And then our, forensic team went into this, and we also checked with our CoWIN team as to whether there is any possibility of data going out. And what are the systems which they have put in place to ensure that such things do not happen. So that part we did, and then of course we also tasked CERT to verify to the basis of these kind of claims. And first day we got that prima facie this is not correct, and second day CERT has provided us a report saying that this was obviously a false claim. So the matter rests there. There is no such report. There's no such sort of stuff which happened.
Okay, so you're saying that the investigation is now complete, that even the CERT has basically said that there has been no instance of hacking. But I want to understand from you, sir, because I'm looking at the statement that you had put out. You said no CoWIN data is shared with any entity outside the CoWIN environment. Can you help me understand what is this CoWIN environment that we're talking about?
See, CoWIN environment, Shereen, that's a good question again. CoWIN environment, basically CoWIN is a platform. And that platform interacts with outside world in 4 measures. One is that you get registered on the platform, and then you put your you select the vaccination date and time and the place, which is basically appointment booking. That's for the citizens. Then of course the hospitals also have to come on CoWIN to publish their platforms. That's the second part. Third part is essentially getting a certificate when you get vaccinated. And the fourth part is basically when vaccinators vaccinate people and then they record the vaccination event, which is the fourth part. So in none of these parts, we are actually giving away information to any person. All these are the only information which we are giving away is a digital certificate, which is actually a file which is just given one by one. So it's not that we have a data dump kind of situation available. And also we have put in many other kind of restrictions in place, which essentially disallows any data download beyond a particular size. So these are some of the things. I will not be able to describe to you all these things, because ultimately you don't tell the outsiders as to what is the what is your locks number. Obviously, you are not going to describe what security measures have you taken. But I can assure you that the security measures which we have in place, both at the cloud level, also at the application level, at the platform level, all these ensure that we don't sort of provide data in bulk to any entity.
Okay. Can I also get an additional clarification from you? I go back to your statement, Mr. Sharma, and you say that the CoWIN stores all the vaccination data in a safe and secure digital environment. I mean, that's like stating the obvious, sir. I just want to understand from you, what does that mean exactly?
It means exactly what I have said, which is CoWIN stores the data in a digitally safe and secure environment. Now, if you want me to explain as to what it means, I will not be able to.
Where is it stored? Where is it stored, sir?
I will not tell you because, why should I tell you that where is it stored? Then, if I'm telling you where is it stored, then obviously I'm telling you where I'm keeping my goods, and anybody can come and attack that place. So what I'm saying is, Shereen, is that you can have some trust on us that we do understand the threats, and we do understand that this data is extremely, extremely important, and from every aspect. First of all, let me also sort of at this point tell you that the only data which we store about citizens is essentially their names, age, and gender, right? Besides, of course, their mobile numbers. We don't store any other data. So that's one part. And that data also is being stored in a completely safe and secure environment. I will not tell you as to what kind of security measures we have taken. Only thing which I can say on a broader perspective is the data is always encrypted. The data is always kept in a manner which is basically downloads are just there are firewalls and firewalls and firewalls which are ensuring that no data download will take place.
Okay. Could I also get a clarification from you, Mr. Sharma, because third-party apps could be allowed to offer vaccine bookings, and I was given to understand from your previous comments that about 15 state agencies and private sector companies had applied for the same, including the likes of Make My Trip, Infosys, Paytm, etc. Where do things currently stand on that front, on third parties being able to offer vaccination booking services?
Great. That's a very good question. The total applications thus far is 125. And you mentioned the parties which are included, and there are a number of parties. They are at various stages. The way the process works is that first they express their interest that we want to integrate with CoWIN. Thereafter, we allow them the entry into what is called a sandbox, where they test their test their application in a sandbox environment. Thereafter, their application is submitted to us, and the National Health Authority has a body constituted for this purpose, which basically examines the applications from the viewpoint of safety, security, and privacy. I mean that they are not storing any data which they are not authorized to store without the consent of the person, and thereafter we give them what is called a key, a partnership key, so to say, a security key, which actually every time they submit something to us, they will have to provide that key to us so that we know that here is an authorized partner. This is how it happens. I will not be able to give you the numbers which have become operational, but I think the numbers are going to be pretty large, including many state governments.
Okay, many state governments and private sector companies. I'm just looking at a statement from Infosys. It seems that they have been given clearance by CoWIN. So would that be accurate? Could you confirm that to us? And how many? You said that over 150 people have applied. Would you be able to give me some indication of how many third parties have been cleared?
Sure. I will look. I have a data with me in front. My office has given me. Total applications are 125. We have accepted 91 applications, which includes 10 government and 81 private applications, right? Then the integration is being finalized of, Paytm, Synergic Infotech India, Jumbo Pay Express, Shivam E-commerce, etc., and of course, accepted private organizations, Dr. Reddy's Laboratories, Make My Trip, ICICI Lombard, Max Healthcare, Infosys, Apollo Hospitals, Ibibo Group, and government is basically Kerala, IIT Bombay, ISRO, government of UP, West Bengal, Karnataka, National Health Mission. So there are a number of them. Of course, I'm not aware as to who have been given the key thus far, but they are in advanced stage, and it's a matter of days, not even weeks, when they will start operating.
Okay. So 91 applications have been cleared, including the likes of Paytm, Make My Trip, Dr. Reddy's, Max, Indigo, some of the names that you just shared with us. Mr. Sharma, I want to now address the larger issue of digital divide, because this has been something that the Supreme Court has raised as points of concern in its order. Now, the Supreme Court has made it clear that given the penetration of broadband services, as well as the access to things like a smartphone, etc., the CoWIN application and making this mandatory for vaccination is creating inequity, is making it inaccessible for a large part of India. Now, one of the other concerns that the Supreme Court had raised was that the services should be available in regional languages. You have done that. You have now provided it in regional languages. But what about the larger issue of making it more accessible and for people who don't have access to technology, ensuring that they are not left out or left behind?
Well, let me begin by saying that I am nobody to comment on what the Honorable Supreme Court has sort of observed, and the case is going on, and we have submitted our affidavit before the Honorable Supreme Court. So that part is there, and I don't want to enter into that debate. But I want to say that in compliance with the Honorable Supreme Court's observations, which were given a few weeks back, I don't remember the date, we have taken a number of steps to ensure that the concerns raised by the Honorable Supreme Court are addressed. So one of the things which you said was that, we have now in multiple languages, we have 12 languages have been sort of incorporated into CoWIN, and its partner application, which is Arogya Setu, is also doing the 12 languages. And we have also enabled, the walk-ins were enabled from beginning itself. And for your kind information, as much as 80% plus people have actually got the vaccination on CoWIN done using walk-ins. So 80% of the people have not registered. They have done the vaccination through walk-in. So the application is.
No, but Mr. Sharma, I want to interrupt you there, sir. I want to interrupt you there because it was very clear, at least in the 18 to 44 age group, the government had come out, and you had come out on my interview and said very clearly, you cannot walk in, you have to register, you have to get an appointment, and only then will you be able to access the vaccine. So at least in the 18 to 44, that was absolutely clear that walk-ins were not allowed. So what is the change that's actually been made now to ensure that this doesn't happen sporadically in some centers, that there is a unified communication that walk-ins will be allowed?
I think you have lectured me enough, Shereen, sorry to say, but don't misquote me. What I'm saying, listen to me. You should listen to your, people whom you have invited. You see, what had happened was that the vaccination for 18 to 45 was opened on 1st of May. And the number of people who had registered on 28th of April, when the registration was opened itself, became 1.37 crores. Now, from 1st of May onwards, if you look at the data, that data had only 3 lakhs, 4 lakhs people, getting the vaccine, or the vacancies were only that much. And the registered number of people were about 6 crores. So what we had advised the state government was that please do not do the walk-in, because if you do the walk-in, then what will happen is that against a vacancy of 100, there will be 10,000 people on the walk-in, because the demand-supply ratio is very, very skewed. So that is why we had initially said that let's not allow any walk-in to begin with. That was a pragmatic decision. That was not, just to exclude some technologically disabled people. That was not the case. So please don't generalize. The walk-ins have been there since the very beginning. And 45-year people, 60 years people, walk-ins have never been disallowed. So it's only that particular segment of people, because of the initial, ratio, the demand-supply mismatch, we had said that walk-in will be a little bit of a dangerous thing to do. So let us open it. And thereafter, we allowed the state government that whenever and wherever they feel feasible, and they are confident of that no law and order situation will be created, they can allow walk-in. So that's the way it is. Just don't, just by having some particular issue, you should not raise it out of context. But let me again go back to the Honorable
No,
Supreme
sir, I'm not. Mr. Sharma, Yeah, no, sir. I totally understand the reason why there was a provision that there should be no walk-ins. Sir, I completely agree with the fact because there was a supply-demand issue. I'm only asking whether there is clarity now on whether walk-in will be allowed in light of what the Supreme Court has said, because there was confusion. That's my limited point, sir. I totally understand why that provision was brought in not to allow walk-in initially.
Right. So what it means is that the walk-in was not disallowed to create more digital divide, as you probably implied in your assertions. What I'm saying is walk-in was not...
No, the Supreme Court did, sir. The Supreme Court did, sir.
Anyway, I'm not joining the issue with the Honorable Supreme Court. Certainly, I'm not the one who can or who should. What I'm saying is that basically number of steps have been taken in compliance with the Honorable Supreme Court's order. And these include multi-languages, these includes walk-ins, these includes also we have opened up, call center in the NHA, a 1075 number, where you can do your booking also, or the search of the, vacancies available, that also can be done through the call center. So I think, and of course, at the state level, wherever the officers are working in the state, ultimately they are also realizing that here is a district where I will have to do more, awareness campaign to ensure that people do come on the vaccination center. So I can assure you that the digital disability of some people will not come in the way of their accessing the vaccination system in our country.
Right. Dr. Sharma, let me also ask you this, sir. There were some instances, for instance, where people said that they had registered, but then their names were not found on the CoWIN site. And a lot of these issues have been since rectified. Could you explain to me, in terms of problems that were raised, for instance, of somebody having got one dose of Covishield, the second dose of Covaxin, which was reported in UP, the NTAGI head, Dr. N.K. Arora, said that there have been such instances reported from other places as well. Could you help us understand where things currently stand on this particular issue, where there has been a mix-up on doses?
Absolutely. I think that's a very important question, and I want to clarify that, you see, one must always differentiate between the platform and the data on the platform. So, for example, there have been large number of cases where people have complained that my name is not correct in the CoWIN certificate, that your name is not correct because somebody, either you yourself while registering or somebody else who basically the vaccinator, they did not enter your name correctly. So that is the reason why your name did not come correctly in the certificate. It is not the problem. Computers are, computers. There's an old adage saying that GIGO, garbage in, garbage out. So if your name is entered incorrectly, the certificate will be printed incorrectly. So what we have done is, so basically, don't blame the platform for this error. What we have done now is that you can self-correct your certificate, and you can do it so only once. That part is there, and since last 2 days, this facility has become available, and we have about 200,000, 2 lakh people have corrected their certificates. Similarly, what happens, Shereen, is that, you enter your mobile number and you create an account. And once you create an account, then you can do a booking, and then you get vaccinated, and the certificate comes, and you are shown as partially vaccinated. Now, it is expected that next time also you will use the same account with the same mobile number. Unfortunately, some people used another account, created another account with different mobile number, and then they booked for that jab. So, result is the system does not know that these 2 people with 2 different mobile numbers are the same people. Because basically we are not doing any deduplication. We are trusting the citizens that they will do the right thing. Just use one mobile number. Now what happens is then the people are stuck now with 2 first dose certificates. One issued by one mobile number, another issued by another mobile. So therefore we are taking steps to ensure that at their request we can issue that second certificate, which is shown as first one, can become their final certificate. So I think we are taking all steps necessary to ensure that the mistakes which are created are corrected. The whole purpose of this, Shereen, is to have a citizen-centric, inclusive application. And that's what we strive to do, and that is what we will continue to do.
If I could just ask you a follow-up on that, sir. You said that over 2 lakh people have been able to correct their vaccine certificates since you offered this service of correction in the last 2 days. Based on the feedback that you're getting, where else do you believe there need to be provisions made to allow for some changes, allow for some course correction?
Well, one is this, error part. Second is the change is not really the CoWIN's mandate. Change is the policy, which actually is given by the government, by NEGVEC, and CoWIN's job is to implement and enforce those policy prescriptions. So we continue to make these changes. Right. For example, initially it was health workers, then frontline workers, then 60 plus, then 45 to 60 with comorbidity, then 45 plus, then 18 plus. All these changes have continued to take place as the policy has continued to evolve. So this is what we ensure, and ensuring that the policy does not sort of create any problems for the people. For example, AEFI. The adverse impact of vaccination, that also continues to evolve, and we are now considering to have if after 30 minutes you have any adverse impact, then also we are creating a facility that you can report on CoWIN portal that I have had this kind of problem. So this is I think important. We are using artificial intelligence and machine learning at the back end to ensure that we continue to ensure corrections, etc. For example, if you have vaccinated as RS Sharma, now you can't sort of change that. Right. Correction cannot happen as somebody else, completely different than RS Sharma. So basically, we are using what is called added distance between two words to ensure that you are not able to misuse this facility of changing the names. We should also be aware that while citizen centricity is important, it's also important to maintain the credibility of the platform. Right.
Fair point, sir. One final question, Mr. Sharma, since you talked about policy changes, and there have been many, including the most recent one where the government has now capped the prices for the private sector for vaccinations, and that price cap will also have to show up on the CoWIN platform, different prices for different vaccines, Covishield, Sputnik, and Covaxin as of today. But there is also some confusion on whether outside of private hospitals, there can be a higher service charge. Now, A, do you have clarity on that? And B, will CoWIN also then tell you what the price will be outside of private hospitals?
Well, CoWIN does not tell you anything. CoWIN tells you what the government tells it to do. So basically, the government has now decided that, 23rd June onwards, we will have a situation where the prices will be 150 rupees plus the prices at which the hospitals get the vaccine. So that's what will happen. As of providing extra facilities and providing extra charge, as of now there is no provision of that type. But as and when it happens, we certainly will reflect it on the CoWIN platform.
Well, yes, you're absolutely right. That is a decision that we await clarity from the government on. CoWIN will, of course, display the prices, which is what it is currently doing as far as the 3 approved vaccines are concerned. Mr. Sharma, always a pleasure. Appreciate you joining us here to give us much-needed clarity on several crucial issues that have come up in the recent few days with respect to CoWIN. Always a pleasure. Appreciate your time. Well, that is the CEO of the National Health Authority, Dr. R.S. Sharma, in conversation with CNBC-TV18. We'll take a break. When we return, we continue with the news. Stay with us.